next session, which is the tale of two systems. Here, you can remain right here for the next session here, or you can click the link in the chat here, or use Attentify to attend the session on CalAble and financial inclusion with Adante Allen here, which is a great tool here. So we're going to take a minute or two for folks to be able to move to the next session. But while we're doing that, while you're doing that transition here, I want to let folks know that I'm really excited about our next session, which is about the Life Care Trust Project, which once again, I think we probably could call today the May and Stanley Smith Trust Day, because they've had their involvement in all of the presentations we're talking about here. Yes.
Hi.
Yes. Okay. So here, so this, just to give us some background as we get into this, here it's a demonstration focus project, which is focused on assisting direct service provider agencies that provide community supports to adapt their services to assist trustees of special needs trusts to better serve their beneficiaries. We at the Golden State Pool Trust have been using this program for quite some time, and has helped us to expand our services to better serve the needs of our beneficiaries here. And with this presentation coming up, we'll also hear from Herb Thomas, a private fiduciary here, who actually uses the program here, and he's going to share his involvement with the Life Care Trust program. With that as well, we have Peter Wall, who is with TrueLink Financial here, who is going to talk a little bit about the challenges of getting services to beneficiaries of special needs trusts, because one thing unique about a special needs trust is it can provide for many things, but in most cases, it cannot give cash directly to the beneficiary. Lastly, we're going to hear from Christine Grabowski, who I've done a lot of work with, and I am so beholden to her about the work that she has done for my clients, my beneficiaries, and so many other. And she'll be talking a little bit about the Life Trust Care case management services there. With that, do we have any other announcements before we jump into this?
Real quick, I will read a statement about the MCLEs for attorneys and fiduciaries. This session is being co-sponsored by the Golden State Pool Trust and is eligible for minimum continuing legal education credits. The MCLE credit is approved by the State Bar of California and the North Bay Housing Coalition. We will read a code during the session, and you must include it in the post-session survey for credit. We're going to again read a code during the session, and you must include it in the post-session survey to get your credit. With that, I will start to bring out our esteemed panelist for this session. Thanks, Steve.
Steve, you want to kick us off?
Sure, let's go ahead and kick this off. Once again, as I kind of mentioned in the short introduction, this is a project that was started a number of years ago here, funded by the May and Stanley Smith Trust once again. And the motivation behind this was that looking for better ways to serve our beneficiaries here, and beneficiaries of all special needs trusts, not just pooled trusts and that sort of thing. And the observation was that many of the services that are provided by ILS and SLS agencies are exactly what's needed to assist persons with disabilities. So part of this today, as we go through this presentation, and because of time, we have a lot of information about each of our presenters, which I would just suggest that you read later here. This is a really exciting program. And what I'd like you to look at is not just how this can better serve beneficiaries of special needs trusts, but also we have this wonderful system that's created through the Lanterman Act. And this gives us an opportunity to expand those services, by the way, at a commercially viable rate. And I think most of us can agree that the rates that we get here for most of the services through the Lanterman Act are barely adequate. I think that would be nice to say. But this is a way that, once again, agencies could expand their services and also possibly have another stream of income. So with that, I'm so excited to turn this over. And I know we have a short amount of time to learn about this wonderful project.
Fantastic. Well, hello, everyone. I believe it's my turn to speak. Steve, thank you for the introduction, and I hope everyone is enjoying the conference. As Steve mentioned, my name is Herb Thomas, and I'm what's known as a private professional fiduciary. And in my practice, I actually focus on the administration of special needs trust, and something called settlement trust is for the receipt of assets when someone is injured and can't handle them. You've heard about professional fiduciaries. We were fortunate to hear Leandra McCormick give her presentation. And, you know, I think she's a good representation of who we are and what we do. And whether it's a private professional fiduciary or an individual family member who's acting as a fiduciary for someone, that is handling their assets, handling the funds that are set aside for them, we all have duties. And we have a duty of loyalty. And that, of course, that duty of loyalty is to act in the best interest of the beneficiary. In addition to that, there's the duty of care and prudence. So to protect assets and to be reasonable with them as well. And as I mentioned, the protection of assets is a big responsibility, because not only is it the assets, but it's the protection of a trust. Because a trust, sometimes when we have vulnerable family members or loved ones, and we've put the resources in the trust to take care of them, there can be outsiders who want to influence or who want to undermine the trust to gain access. I'll just give you one example. You know, we've all watched TV for the most part, and we have probably seen these different ads where, you know, hey, we can undermine that annuity. You know, you've got structured payments, we can undermine that. They don't use the word undermine, but certainly they can find ways around it. Same thing happens with trust. The same thing happens when you have a professional trustee in place looking after a trust. There could be outsiders or even sometimes the beneficiary themselves. They don't like the terms of the trust. They go find an attorney who will help them, and they'll attack the trust, if you will. Well, the fiduciary has not only a responsibility to protect money, but to protect the trust document, the document you may have prepared in order to preserve these assets to last as long as possible. And another duty is to account. And that means that we have a responsibility to show the work, show what took place in the trust. What did we start with? What did we disperse? What did we earn? So those are some of the major duties of whether you're using a private professional or you have an individual family member serving as the trustee. Pete, can we go to the next slide? Now, just a quick overview. I'm not going to get into everything, but as you see on one side of the slides, it says that fiduciaries are a jack of all trades. Talks about being a counselor to the beneficiary, an advisor, an analyst, a public benefits advocate, if you will, sometimes a mediator. And of course, you know, just as a personal counselor, as a psychologist, kind of listening to what's going on. Besides being a jack of all trades, A fiduciary plays a couple of roles. And today's presentation, we're looking at us as trustees, in particular special needs trusts, but also sometimes as conservators. Many times fiduciaries will serve as conservator of the person and estate. And what that means is the estate is taking care of finances that are not in trust, and the conservator of the person is looking after the physical well-being of your loved one. That is where they live, how they're clothed, the meals, and just looking after their well-being all around. Some of the duties, again, include protecting assets, budgeting, securing housing, making distributions. So that's the fiduciary angle. Now I want to talk about the life trust care. And I've had some very good experience. I, as a private fiduciary, have engaged life trust care services. And I want to say to you, as a fiduciary, particularly serving as a conservator, we are the jack of all trades. We can do it. You throw it at us, we'll go ahead, we'll resolve that problem. But it comes with a cost. Our hourly fee can be a little bit more than what you would expect if you're using someone from the Life Trust Care Services. My experience has been with East Bay Innovations, and you're going to hear from Christine in a few minutes, Christine Grabowski. And I have to tell you, I've had phenomenal results working with that agency. And a couple of things I want to point out about my experience is I found them affordable. You know, my hourly fee is a little bit more than what you would expect from a Life Trust Care Services organization. I found them to be knowledgeable. They know resources, housing, public benefits, even medical services. And while I, as a fiduciary, have access and experience and knowledge, it takes time. And what I find is they're very well connected in the community. In addition to that, I found them to be very responsive. Phone calls, emails, follow-up. They're there, responsive, get back to me. And one of the last things I'll mention about it is results. Now, I've had always good results, but you know, the world is not perfect. You run into bureaucracies, you run into, you know, brick walls, and things just always can't get done. But that hasn't been my experience. I've had good results. I can't promise that everything will turn out the way we want it, because life is not perfect, but I've had always good experiences. The last thing I want to say about my experience is that they are not there to replace care managers. You may have care managers from the regional center or the other organizations, or even private care managers. This is a supplement, an addendum, if you will. It's the boots on the ground. While I could run and do things, it's really nice to hand off and have a partner out in the community who can do them just as well, and sometimes even a little better than I can. So with that, I want to encourage everyone to consider these resources and use them. And I want to thank you for your time. Next person, please.
Hello, my name's Christine Grabowski. I know some of you were expecting Tom Heinz today, but he's not with us today due to unforeseen circumstances. I've been with EBI for 12 years. I've worked within independent living and supported living. I've been the director of both those departments, and I've had the privilege of working within our transitions program. That's helping people transition out of skilled nursing facilities back into their own homes. And back in 2017, Tom and Steve approached us about starting this new program, Life Trust Care. We are a collaborative of 3 agencies that have come together throughout the greater Bay Area. It's on the PowerPoint there. We have over 50 years of experience in this field, providing independent and supported living services and employment services. It felt like a natural fit to roll these services over into providing to a broad range of people with disabilities and mental health issues, and also seniors who are also in need of supports. So with that, we decided to work with Stephen in 2018. We really sort of jumped into this to sort of build what we see as a new service model. You can forward to the next slide, please. So for families, we're already working with families now. We provide with our families, we work collaboratively with our families to ensure that their goals and the person's goals are being met. Currently, we are regional center majority of people that we serve. So we understand the need to balance that. As Herb said, we don't want to take over anyone's position. We are an additional wraparound service. We understand the need to maintain those services, and we work diligently to ensure that we are not overstepping on any regional center services that are being provided by case managers. Or if they're in a supported living home, in a group home, again, we're an additional service. But what we can offer is that additional wraparound services if there's help with public benefits that are being messed with applications, collecting documentations. We also understand that over time, people's life circumstances change. So you need to relook at benefits again. Maybe someone's coming off SSI and going on to SSDI. But you still need to maintain that Medi-Cal benefit, which is really important. And you don't want to lose Medi-Cal because they're going to gain Medicare. We understand those rules, and we understand the need to go apply to keep Medi-Cal in place. We also work with IHSS, in-home support services. We can help hire and train IHSS providers. That is a huge part of working within a system of care providers. They're another added layer. Even if we come, as Herb said, we come at a lower rate than some care managers, our agencies. However, IHSS providers are a public benefit. It is access through their Medi-Cal, so why wouldn't we access that benefit? That's the benefit they should access first before they're paying a care manager to come in and help with basic like grocery shopping and meal prep. We really should go to the IHSS provider and ensure that that's in place so we can help families and we can help the individual work within their natural supports. And that's what EBI really strives itself on, is building a natural support within the community they live in. Most IHSS workers live within the community they're being hired to work within. We also provide a one-to-one service, which regional center case managers, they have a caseload, they can go out and get an independent living agency like ours. But if someone doesn't have those resources, they're missing out on that one-to-one in-person community resource. We meet people at where they're at, whether they want to meet at home, in a coffee shop, maybe they just want to meet up at a medical appointment. We are community-based in our community. The other two agencies are community-based in their communities. I wouldn't go into Napa and they wouldn't come into Alameda County. So we do work together. So besides applying for public benefits and helping maintain those and in-home support services, we also can help with building life skills. There's more to just finding affordable housing. When you're looking for affordable housing, it's about being ready for that affordable housing, being ready to move out and live in your own place and maintain it. So we can work on life skills, making sure there's an emergency plan set up in place. They understand what an emergency plan is. They have the skills to go grocery shopping, to budget, working closely with the fiduciaries if there is a budget to live within, if they're the rep payee and we have to stay within a budget. We want to have that all in place when we move someone out so we know what they're working with. At that time, maybe when they lived in a group home, they didn't qualify for CalFresh, but now that they're living out on their own, they can apply for CalFresh, which is also known as food stamps. So those are, like I said, about reassessing benefits, which are really important to constantly look at. I think every year we do that. Another big part of case management, medical appointments, the coordination of going to medical appointments, the coordination of if a specialty is needed, to finding a specialty, especially if they're on Medi-Cal or Medicare, finding one that will accept those insurances, staying within their area is also important. You don't want to find someone, a specialist, if they live in Alameda County, but yet they have to go all the way to San Jose, they might not be able to get to that appointment then if it's required to on a regular basis. Our goal is to really find a doctor or a specialist within their community that's easy to get to whether it's access to public transportation, paratransit services, or these days, Uber and Lyft are real popular. Medical appointments, I think one of the things, if anything we've learned in the past year, coming down to now, is besides doing tele appointments, have become a huge part of supports and getting people to learn to use the internet and accessing their tele appointments via whether it's an iPad or a smartphone. That's become a huge need these days. We've also gone out in the field with people who can't and bring them our laptops so they can attend those medical appointments. Just the past 2 weeks, we have learned to navigate every online system onto get a vaccine schedule. This is not an easy task for people to maneuver. It's been difficult for us to learn. It's like a crash course in how to maneuver the COVID-19 vaccination websites. But having that added layer of support saves time. I spent an hour and a half online with Walgreens to schedule one appointment. So we save time and money for people when you have to be on those calls, and it takes time. We also, where some of the things, as a regional center vendor ourselves, we have limited time with people. So we don't always get to meet those recreational and social activities that are really vital in all of our lives. It's not just, it shouldn't just be seen as, for people who have means to have a recreational and social life. Recreational and social, everyone needs that. So with Life Trust Care Case Management, if that need is not being met through other wraparound services, we can work with them, the families, the fiduciaries, to see what it is we can provide to help them find a social network.
Christine, I want to make sure
yes.
to get in before we run out of time. We've only got a few minutes left here.
Oh, okay. Sorry.
To receive your MCLE credit, we need you to write down the following code. It is 3365. Again, that code is 3365 and included in your post-event survey. If you wish to receive that MCLE credit, please complete the appropriate form, fill in the proper codes for each session, and return it to amy@gspt.org. So that code is 3365. You will be returning it to amy@gspt.org. And I think we've got a few minutes left for Pete Wall.
Sure. Thank you, Chip. Christine, that was fantastic. I wish that the Life Trust Care organization was around when I was doing 20 plus years of fiduciary work. Some of the things that you didn't have a chance to mention, which I find would be absolutely invaluable to a family member fiduciary or a professional fiduciary, is some of that money management and budgeting assistance, right? Some of the things that we have issues with as trustees are having our beneficiaries stay within a budget. And that can be very difficult for everyone. Heck, I know my wife would love it if I could stay within a budget, but it's just not going to happen. So, part of the tools and services that can work hand in hand with professional fiduciaries like Herb and the Life Trust Care organization with Christine are simple budgeting tools. And this particular screenshot that we're seeing right here is just from the TrueLink system. We provide systems for money management and things like that for both family member and professional fiduciaries. But I want to touch very quickly here on something Steve was mentioning in the prior section, which was that ISM reduction or ISM reduction, and how can we easily facilitate getting our beneficiaries funds. And one of those tools is the TrueLink prepaid debit card. It's recognized in the program operation manual system or sort of the guidelines for SSI as a way to put money into our beneficiaries' hands so that they can use it in such a way that may not negatively affect their means-tested public benefits. I was a TrueLink customer before a client, before I was a TrueLink employee. I can tell you that this card is absolutely a wonderful thing for beneficiary empowerment, to empower people with a disability or on means-tested benefits to be able to go out and make their own purchases, have that self-empowerment feeling. And when you kind of combine all these three things with the private fiduciary and the Life Trust Care and the TrueLink card as a mechanism for distribution. I feel like we can really make a tangible difference in what I think is probably the most underserved, but the most deserving population in this country. And I'll turn it over to Steve very quickly for closing remarks.
Anyway, I know that we probably could have spent hours covering this, and I know there'd be a lot of questions here. So we really do invite those questions. Once again, we're basically out of time, but just to finish up, hopefully what you've learned from this here is that, when it comes to special needs trusts and that sort of thing, ideally coordinating with service providers, with advocacy organizations, bringing our professional organizations and our service organizations and our advocacy organizations is one path for a better quality of life for all persons with disabilities, including folks with IDD. And with that, I want to thank you so much, and I want to thank the conference for indulging us here with this presentation.